Good morning, everyone. Welcome to another talk show on REWAC. The REWAC intends to commemorate the World Malaria Day, celebrated on the April every year. We are going to be talking to you about the health effects of malaria on pregnant women. It is well known that malaria is a major public health concern. What is malaria? Malaria is a parasitic infection caused by the bite of a female Anopheles mosquito. It is caused by the Plasmodium species, of which we have 5 of them: the Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, Plasmodium malariae, and Plasmodium knowlesi. But the one that commonly causes malaria is the Plasmodium falciparum. Okay, so with me today, I have Laura, Shante, and Manda. So over the years, malaria has been an important public health concern, as I earlier mentioned. So it contributes to the maternal and infant mortality ratio. The risk of developing complications due to malaria during pregnancy is high.
So today we are going to be asking some commonly asked questions in the community. We'll go through the website and check some of the questions. I'm sure we have them in the tablet.
Okay, so we have the first question. Why is malaria in pregnancy dangerous? Very interesting, right?
Yeah, it's a very interesting question. Wow.
So,
Alright. I think malaria has an effect on both the mother and the fetus at all stages of pregnancy. First trimester, second trimester, even the third trimester. So maybe we can be listening to those things. What do you think of?
Okay, to me, I think that malaria during pregnancy causes stillbirth.
Okay. So that means you give birth to a baby that's
That is
died.
dead.
I really don't want to have malaria when I'm pregnant.
yeah, and it's caused by malaria. To think it's caused by the common malaria that we overlook in the society. It's outrageous.
There is also the problem of miscarriages. People miscarriage because they have malaria.
Okay, that would mean the woman is pregnant and then maybe in the first 3 months she loses her baby.
Yes, because of malaria.
Oh, and then sometimes I think women give birth to babies who are small for their age. They have a low birth weight. Like say child weighing 2.1. Or even 2, let's say.
Yeah.
The child is at term. You know, normally when you have a premature baby, you have a low birth weight. But now a child is at term, with the mother having malaria can cause the child, instead of weighing the normal, let me see, what's the normal weight?
So I think
2.5, 3, yeah.
Yes, the baby
So
comes down with a
anything
weight of
2.1.
2.1.
Some even come 1.8.
Hey!
Yeah.
Okay, and you know malaria also causes prematurity. You give birth to a baby when it's not yet time.
Yeah.
And those kind of babies who have that 1.8.
Yes.
And now you're spending so much money. Maybe you go to the hospital, they tell you you're having malaria, say you're supposed to be admitted, and you're like, no doctor, I'll go take Contrimexin. And then bam, it's not even up to 9 months. At 7 months, you're giving birth to a baby that has 1.8. It's weighing 1.8.
Let's not concentrate only on the fetus. Malaria do affect the mothers as well. You will hear a pregnant woman having kidney failure. It's not normal. So we should not treat this malaria problem
Have you ever seen a case before?
Yeah,
Okay.
I've seen a case that a woman had kidney failure because of malaria that was poorly treated.
Yes. And you've heard about this thing they call, is it Coca-Cola urine? The color of their urine changes. Sometimes people who have this kind of urine color may are prone to a kidney failure. You know, the mother shares the blood with her and her baby. Now, the malaria parasite that you mentioned, you said Plasmodium falciparum. I'm sure it feeds on the blood of the patient, of the mother. So if it feeds on the blood, it means it's going to reduce the blood level of the mother.
That's anemia, right?
Yes, they call it anemia.
Causes anemia. So I think another another effect on the mother is immunosuppression.
Okay.
This is a state in which the immune system of the mother is weakened, leading to other opportunistic infections.
So I have another question. Is this immunosuppression the same with anemia? Because I think anemia has to do with low, when your red blood cells are not strong enough to...
No, immunosuppression is another thing on its own. Immunosuppression targets the immune system.
Have you noticed that pregnant women have malaria more than normal people who are not pregnant?
Yes.
Yeah. And the rate is really
I
high.
think it is because of that immunosuppression. Their immune systems are already suppressed, so now the rate at which they can easily get malaria now is higher.
And pregnant women are always going out to eat themselves at night.
Yes,
And so they expose themselves to the mosquito. And usually they are warm. Mosquitoes like warm. Let me say they are warm. They are warm.
Because we are not pregnant.
Okay, alright.
That was so educating. So I think let's move to the next question that we have. What's our next question?
What is the impact of malaria? What's the impact of malaria infection on the fetus?
That's very, very nice. I think we have mentioned some points. But I think our listeners would like for us to do a little bit deeper, or probably if there are some things that we did not mention, maybe we can mention.
Because somebody will ask, the mother has malaria, how come the baby too is affected? Because the mother who has malaria, not the baby. But then we know that the mother and the baby, their blood doesn't mix, but they have a connection. What's that?
Placenta.
Of course, the placenta. So when the mother has malaria, you know that malaria feeds on red blood cells. The placenta has red blood cells, right? So it's going to affect the placenta.
Really?
The placenta gets sick. Yes.
Oh, the placenta
That's how
has
the
red blood
baby
cells.
gets. That's how the baby gets.
Wow.
The parasites are passed from the mother to the baby
Through
through
the
the
umbilical
placenta.
cord.
Okay.
And then when it also affects the placenta, you know the placenta now it gets sick and it will not be able to do its function to transfer nutrients to the mother, to the baby, and that's why the babies come up with their low birth weight.
Malaria can also result to spontaneous abortion. You can hear a woman complaining constantly of miscarriages, not knowing that it is because of malaria infection that causes the miscarriages to become so frequent.
And we know that we're in an endemic region. I don't think any of us here has never had malaria. I've had malaria countless times.
Yeah.
Africa in general.
So I think at this point maybe some of our listeners will be wondering what abortion is. When we talk about abortion, we do not mean the illegal abortion. We are talking of the termination of pregnancy before it reaches term, that is 20 weeks. So one of the causative factors could be malaria infection, and sometimes when it happens like this, people in the community attribute it to witchcraft. Yes, the people attribute it to witchcraft.
So this abortion you are talking about is not as in somebody has malaria and then decides to go to the hospital for it. No, it's just
It's spontaneous abortion.
it happens on its
own.
own.
The other one that
Can we call it miscarriage?
That's miscarriage.
Let us call it miscarriage so that even a layman in the quarter will understand. Because when you start talking about abortion, they start thinking.
No, that's why I have to explain now that abortion, this is miscarriage. Yes, but if you should go to the hospital and they tell you that this is spontaneous abortion, you should not be embarrassed or feel like it does.
And I'm sure if a pregnant woman goes to the hospital with bleeding, even if it's known that you shouldn't request for a malaria test if the patient does not have fever. So sometimes, since we're thinking that we're in an endemic region, we do some, how do you call it? in provisions and try to see to better manage the patient. So we always want to request for malaria test for a pregnant woman who is bleeding because it's one of the causes now it can lead to miscarriage.
So the bleeding now is one of the signs
Exactly.
of malaria.
And I'm sure when the woman presents with some, a pregnant woman presents with bleeding and the causes malaria should be admitted or treated as a severe malaria.
The bleeding is a
And
sign of miscarriage.
This bleeding itself, as a sign of malaria, does not only occur that it's coming from the vagina. You can bleed from your nostrils to that.
You know, even for non-pregnant women, there's a severity criteria you use for malaria, and abnormal bleeding is one of them. Where you bleed from your nose, they call it epistasis.
Nose bleeding. Alright, so I think we've exhausted this part so much, and I'm so happy with the contributions. I hope you're learning something from this discussion. So we'll go to our next question, which is, how can the adverse effects of malaria in pregnancy be treated? Be prevented, sorry. Thank you very much for that correction.
What do you mean by, what are you trying to say?
Prevent malaria in pregnancy. What are some of the things that you think we can do?
Well, I think what this question is asking for is all of these things we have mentioned: the low birth weight for the fetus, the anemia for the mother, the miscarriages, the stillbirth, kidney failure. How do we prevent it? Because these are the adverse effects. That's what makes malaria dangerous. And I think to prevent these adverse effects, we have to prevent malaria in pregnancy. I think we have national guidelines already for that. Some routines, like they give these 3 tablets to pregnant women.
Every pregnant woman should sleep under mosquito nets.
Okay, and it has to be treated.
Well treated mosquito net. We should not just talk about mosquito nets and start using any kind of mosquito net. When you go for your antenatal, that is why it is encouraged.
What's
that
antenatal?
when you go for clinic,
okay,
for your regular checkup when you're pregnant.
Yeah. When you go for your regular checkup, they always provide 2 nets. Those nets are not meant to be kept under your pillow.
Or to be put in the fan.
Oh, yeah.
Yes.
Oh, to nets. Yes, organic. Those nets are provided in order for you to sleep under, in order to prevent malaria. So we should take that part very seriously.
And you have to properly tuck them in.
Yes. Not just hanging it. Yeah. Not just hanging
And
it.
take care of them in such a way that it avoids, it prevents this bugs. Like it should not have holes.
That's why I said when you go for your regular checkup,
So if you
come back and change
That one that has been there.
No, sometimes even the new ones can get
it's for
torn.
free.
okay.
It's for
Sometimes
free.
even the new ones can get torn. So I'm telling the listeners that they should take care of their nets in such a way that it avoids it from getting torn, because there is no reason why you should put a net that has holes that mosquitoes
Bigger than the size of the
Oh,
mosquito.
mosquitoes.
There is something about this mosquito nets. Thank you for bringing it up. Many a time when people take these mosquito nets, they don't air them out before putting it, and it can lead to another illness. That's what many people fail to understand. When you take your mosquito net, you have to air it out before you go and set it up in your bedroom. You air it out for how many?
24 hours.
Yeah. For 24 hours before you start using it. If not, you can develop an illness. And for a pregnant woman, you don't want to take risks like that.
You don't want to.
Then there's the rainy season. Standing water is almost everywhere. And that's breeding space for mosquitoes.
So
So they should
advise
train-
that they should fill those standing water,
Yes.
those potholes
Those
that
potholes.
will give access to those water. We should do our best. It's not only for the health personnel. No. Even at the level of the community, we should do our best to see that our environments are always clean. We should not say no, we are living in a rural environment. Our farms are around our houses. We can just remove dirt from the kitchen and pour them in the farm. You are hosting malaria, of which is not good. during pregnancy. So we should do
To any
our
other
best.
person.
Yeah.
Yes.
I just said pregnancy because today we are elaborating more on pregnant women.
Yeah.
Okay, so to add to the prevention of malaria, I think that's what we're talking about, right?
Yeah.
I think we can use insecticides. These mosquito sprays now. I think they think cost like how much?
Like 1,000,
In
1,000 francs.
ranges from 1,000 to about 5,000 francs, but you can still get a good one at 1,000 francs.
They should a pregnant one spray her house.
You spray in the door, stay outside.
Stay outside.
Yes,
Yes.
by, let's just
For like
say by
half
5 p.m.
Okay.
you spray the house. You don't want to be out too late, so let's just say by 5 p.m. you spray. Lock all your doors and windows. Then after about an hour or 2 hours, you can get into the house.
Free to go into your house.
And there are also coils, mosquito repellent coils.
How do they call it?
Moon tiger.
Yeah.
With moon tiger, you can even sleep in the same room. It has no strong effect.
Really?
Yeah, but to be on the safe side, the pregnant woman should excuse herself when she
Burns the
burns moon tiger.
But now how will she excuse herself when you have to, I think it has to go on for the whole
Whole
night.
night.
Yes.
Yeah.
So
I think so. So maybe she can keep it in the room but far off from where she's
Yeah.
laying her head. Okay. Alright, that's good. And I think NGOs like REWA should create awareness on malaria prevention.
Like we are creating, we
Okay.
are inviting other stakeholders to create more awareness, and we want to appreciate those who have been in the fight so far. Organizations like Community Distribute Nets, so many other organizations distribute mosquito repellents and educate people on the effects of malaria during pregnancy.
And that is why we want to join the world to commemorate these activities.
Yes.
And we are really teaching it because I'm feeling it in my body.
I hope you're feeling it. I'm feeling it. So if you're just joining us, we are talking about the health effects of malaria on pregnant women and to her fetus. So let us continue with our questions.
Yes. I think we have the last question. No, we forgot about one thing. I was going to ask you or anybody about the Twitter basic gift to pregnant because I know it's for malaria prevention. They call it the fancy. Yes. For malaria prevention, they start giving it, I think, when the baby starts kicking.
Yes. See, when you finally give birth, it prevents malaria.
And those who don't go to the hospital for antenatal, that's the clinic visits, they don't benefit from things like
And
that.
it's free.
Okay.
Yeah.
So it's
But don't you think some hospitals sell it?
No, it's free.
So it's important
It's
that
free.
we go for our ANC because you cannot be informed while you're at home. Yes. So,
Oh.
Sometimes women give birth to children and they're like, my picking day like frocko, my picking day like frocko. It's because they have ignored this.
Like that,
Yes. There was a case in Boya that they were saying it's a scammer who did whatsoever with it. The news was
Boya
taken
and
on
news.
social media.
News.
At the end of the day, they found out that this lady was not going for her antenatal. So she wasn't getting these drugs to prevent things like that.
And there's one common drug they always give to pregnant women. They give folic acid.
Folic
Yes.
acid.
I think it's very good.
If you are pregnant and you're not taking
some
folic
practitioners
acid, then I
even
don't
advise
know.
that if you are
3 months to conception.
Exactly. If you have the plans of getting pregnant, you should start taking your
Folic
folic acid
acid.
before you get pregnant.
I think folic acid targets the anemia. It prevents the pregnant woman from having anemia. Anemia, which is shortage of blood. So when you take your folic acid, your red blood cells are so energized in a way that you cannot have
And
malaria.
you have enough.
Yes.
But there was somebody told me, if I'm not mistaken, that folic acid boosts the breathing level of the baby.
Aww.
Yes. So
Yes, because
encourage.
they have known that folic acid deficiency will cause there's this thing they call spinal bifida, where the nervous system or the spine of the baby comes out. You see a lump on the back, something exposed because of folic acid deficiency. So it's something that's very important,
Yes.
not only about malaria, but pregnancy as a whole. Like you said, it helps in the development of the baby's brain.
Yeah.
Yeah.
So if you're pregnant or planning to get pregnant, please take your medication. And I think one tablet is just like 10
One sachet is about 150. It's not expensive now. 150 francs.
The sachet, yeah.
Yes, it's about 12 in that
okay, you're
sachet.
saying
A card, sorry.
I think in rural areas,
They are giving
they
for free.
distribute them for free.
I think there was one time, it was in Rewa, an NGO was sharing folic acid, these small cups, they have like 100 tablets in it for free, and even they fancy that.
I'm sure the pregnant women and community benefited a lot from that.
Yeah, I think we exhausted that question. So we have the last question. Who is going to help us with that one? Is it safe to take anti-malaria drugs during pregnancy? Is it safe?
If it is prescribed, I think it depends. If the doctor has prescribed it, because you don't just go and take over-the-counter medication without prescription. If your doctor has prescribed and you take this thing,
Prescribe the right
dose,
dosage.
yeah, you take it.
And you know you have different anti-malarials, drugs that are used to treat malaria. You have like quinine, you have normal coartem, and you even have injectables. And this one that they give as prophylaxis to malaria.
I don't think they really advise pregnant women to take the injectable.
When you have a case of a severity, how do you treat it? You have to treat
Okay, that's
But it's even good to prevent it.
yes, the
If
best.
you ask me, I will tell you that we should always go for our fancies. Yes, we should not laugh when it comes to our fancies.
So now it must be prescribed.
As far as we are going for a
I'm talking about fancy. I'm talking about the drugs in general. If you're taking a drug, it should be prescribed. Because there's a reason for prescription. When a doctor gives you a prescription, it means that the doctor has assessed you well enough to know that it is good for you and the baby. So it is safe.
And now they'll give you the drugs depending on the trimester of pregnancy.
Yeah.
Because you know that in the first trimester of pregnancy, you have to be very careful with your drugs, the drugs that you take as a pregnant woman, or the drugs you prescribe to pregnant women. So I think that the practitioners already know how to do that also.
Yeah.
So we're advising every pregnant woman, if you feel feverish, you're feeling weak, you're having joint pains, you see some spotting, go and see a medical doctor, right? Or go to the hospital. Because
the nearest clinic.
You cause more harm to yourself going by the roadside.
Don't go to the roadside too.
You've heard there's
Don't go to the doctor.
There's even one drug circulating. I saw it was a communique was released the other day about a certain syrup that has killed over how many children. So just imagine someone who is not informed. Even the person selling it by the roadside doesn't have that information. That's how
our take-home message.
Some people selling on the road even they don't care. They want, since they paid money for the drug, they want to sell it without them.
And sometimes they sell expired drugs.
And you never know. So our take-home message to pregnant women is that it's not really like our major take-home message, but on this point that we've elaborated, we're trying to say that do not go to somebody from the quarter whom you think has a degree in nursing or you think has a doctorate, do not just go to that person. You don't just entrust the life of yourself and that of the baby in the hands of somebody who is not eligible.
Thank you very much. I hope we've all heard everything we've talked about. Pregnant women, let's stick to these precautions and we are all going to be fine. We thank Rewa for giving us this opportunity to educate ourselves, and we are hoping that you will like our page on YouTube, Facebook, and even on LinkedIn. I think we have a page there.
Don't forget to follow us for more updates, because the health talk is something we always do to educate the public about health issues.
Thank you all very much. We are so honored to be here once more.
Okay. So if you're having any questions, just drop them down on the comment section. We'll be replying all of the questions.
And we'll have another table talk
to answer
your questions. Yes.
Thank you. And feel free to visit Rewak at all times. Our doors are always open.
Always open. Always open.